Hey everyone, thank you so much for joining Baltimore County Fire Department EMS Academy. For those who I haven't met, my name is Sean Barinholtz. I am an anesthesia and ICU physician at Hopkins. I am an active member of Pikesville Volunteer Fire Company in Baltimore County, and I have the honor of serving as one of the associate medical directors for Baltimore County Fire Department. On behalf of the EMS office, Chief Nats, EMS Training Academy staff, and Captain Lenny Stewart, thanks for what you guys do. Thank you for your dedication to lifelong learning. Big shout out to Ashley Brooks. Ashley is a young member of Pikesville who will be helping us with your CEUs towards the end of the training. Ashley will put a link in the chat. Click the link, enter basic information, get your MIM CEUs. If you have any questions about the CEU process, you need transcripts, or have trouble entering your information, please hang out with us after the training and we will be happy to answer your questions. So tonight, I am Ashley and I are super excited to have with us three amazing people. Dr. Jody Cripps. Dr. Cripps is an assistant professor of American Sign Language in the Department of Languages at Clemson University. Dr. Cripps obtained his doctorate in the second language acquisition and teaching program from the University of Arizona. His research interests primarily focus on universal design and deaf people, sign music, signed language pathology, social responsibility, and ASL-English literacy methods for deaf children. He is currently an editor-in-chief for Society for American Sign Language Journal. We also have with us soon to be Dr. Layla Craig. Layla Craig has been a practitioner in disability inclusion disaster risk reduction for the last 10 years. She has been involved in local and international projects focusing on the inclusion and resilience of people with disabilities and disasters, with particular attention to deaf communities. Her work included a nomination for the prestigious 2019 United Nations Award for Disaster Reduction for Best Practices on Inclusive Disaster Risk Reduction. As a PhD candidate in the School of Geosciences at the University of Sydney and an active member of the Sydney Southeast Asia Center, her research studies focus on the capacity of organizations to respond to and to support deaf communities affected by disasters in the Asia-Pacific region. Currently, she works as a disability inclusion and engagement officer for Fire and Rescue New South Wales in Australia. Thank you all for being with us tonight. We super appreciate you. Dr. Cripps?
Hello. Thank you. And really, thank you, Sean Barinholtz, for inviting us and having us today. Layla and I are thrilled to be presenting. We have, I've presented in Baltimore County previously. I used to live there a while back, 6 or 7 years ago. So it is a place that I miss. I do love Baltimore and the environment and the people. So I do now currently reside in South Carolina, and the Louisville Fire Department in Baltimore is where I first began working with emergency teams and worked with students who were a part of service learning projects with Clemson University in the Deaf Studies program. And so we did work with the fire departments there, and also working with deaf victims and advocacy. We also noticed at that time how many mistakes and misunderstandings can occur in emergency situations. And that is when I became involved over the years, and I picked up more and more on emergency preparedness for deaf people. I have been thrilled to have young blood in the room with Layla to really take us into some of the more emergency preparedness information. Thank you so much, Jody. And yes, I also want to thank very much Sean for inviting us here today. Sean did explain yes, some of my background in emergency services. And we won't go too in depth today, but it almost several years ago at this point is when I began in Australia. And the Australian Red Cross was where I first got my beginnings. And they asked me to come and work in the Philippines in a disaster risk reduction position, and particularly focusing on deaf communities. What we noticed when we began there, or what we realized and brought back to Australia, was that the data on deafness or deaf people in emergency or disaster situations is extremely limited. There's plenty of data for hearing communities in disaster relief, but not much for deaf communities. And so in my unique position, where I am deaf and I do use the language of deaf people and have the cultural knowledge and aspect already embedded, I think there's a lot that emergency preparedness people all over the world don't necessarily consider or realize when making plans. So I realized that this is what I needed to focus on, and that became my study for my PhD. And I do work for the fire and rescue in Australia, and we work with the deaf community, we have developed some resources for the fire and rescue departments on how to engage and work with deaf people in emergency situations. And then related to the deaf community members who belong to the different organizations. And so those are some of the resources that we are able to provide for them. And then in particular, we provide trainings. Should an emergency occur and there are deaf people in the community, we have resources to provide for deaf people to learn more about emergencies, and also for the emergency preparedness individuals to learn about how to deal with the deaf community in those situations. All right, great. So this is Dr. Cripps. I'll begin with our presentation. So as Layla said, we want to give big thanks to Cheryl Kopler, who helped us to develop this presentation, this PowerPoint that we're sharing with you today. Cheryl has retired, but you will see the wonderful work that was done here and that we are utilizing today. And I'll go ahead and go off camera for now. So today, these are an overview of what we'll be presenting. We've already done the introduction, some general facts about deaf people and sign languages. We'll introduce the concept of the whole community. A lot of you may be already familiar with this, but we'll give you a refresher about emergency management with the deaf community and how to partner with the different groups and resources that are available to you. The emergency management within the deaf community, we'll go a little more in depth into. We'll do some learned sign language in this presentation. So I hope you're looking forward to that. And then we'll recommend some further trainings, further ways to improve your relationships with deaf and sign language communities. Next slide. So often I get this question. I want to ask the group here: is sign language international? You just want to give a yes or no, unmute or chat. Right? The people who have answered so far, no, sign language is not international. Layla actually uses Auslan, which is Australian Sign Language. I also can use Australian Sign Language as well. I lived in Australia for a time and I do use that. But I typically, use American Sign Language here in the US. But there is a big difference between the two. So every country, so to speak, has their own sign language. Some countries may have different sign languages, even within one country. So for instance, I grew up in Canada, and there's 4 primary sign languages used in Canada. ASL is used in Canada, LSQ, which is a Quebec sign language, and then Maritime Sign Language is also used in the eastern part of Canada. And then an Inuit Sign Language is also used in Canada. And so these, you will see multiple sign languages even within one country. So the answer is no, sign language is not international. Check for everyone who got that correct.
Do you see there's a chat question?
Oh, I didn't see that.
Or I don't know how to pronounce it. Ausian?
Auslan?
Oh, it looks like an I. Got it. I see the L now. And ASL, mutually intelligible?
Right, good. I guess, yes. So the question is, I think what you're trying to get at is that are there, are they both the same? So I would say there probably 80% of the signs are different. So there might be 20% or so that is, shares some common features, for sure, but and then maybe a few common signs, but
Thank
they
you.
use classifiers maybe that, which is an aspect of the language of signed languages that they might use similarly. So like this might indicate a car in both languages, and then how a car moves, probably would be, yes, intelligible in both if you only knew one language. And so, yes, between, other people who use languages that are use signed languages, they might understand well, but they do differ vastly ultimately. And yes, whoever answered question number 2, ASL is not a form of English. That is correct. Yes. So yes, ASL is its own language. And I think a lot of people don't realize that ASL is actually very strongly related to Japanese in the way that the word order and the grammar and syntax is produced. Is very similar to Japanese, in fact. So good answer. Does anyone have a guess for question number 3? Who uses American Sign Language to communicate? Okay, someone said Americans and Canadian people. Okay. But who are the American and Canadian people who use the sign language to communicate? Do hearing people use ASL to communicate?
Thanks.
Oh, I see. Okay, deaf, CODAs, hearing people. All people can. Oh, now everybody's joining in. Great. And anyone can. Yes, including you. Yes. Very good. Deaf, hearing. Okay, great. Interpreters, CODAs. Yes. And the true answer is that anyone can, right? And more, they're teaching baby sign now. And so maybe it will be everyone. Yeah, people who lose their hearing later in life, but in different reasons that people take sign language courses. Sure. Great. Wonderful. So yeah, the answer is anyone. Yes, and baby signs. Good. Glad people are doing that. The question here is, why do deaf people sign? Oh, I lost the chat feed for a moment. Okay, right, for interaction, for communication. Yes, and deaf people, of course, auditorily don't access language and perhaps don't use verbal speech either. And so it's an alternative form of communication. Yeah, I see someone saying alternative form of speech or language. Yes. And it really, it benefits all of us. It doesn't just benefit deaf people, especially in emergency situations. How many times have you been at a distance where you wouldn't be able to even shout and hear someone? Perhaps there's very high winds, a hurricane, tornado situation, and you wouldn't be able to speak to another person, but perhaps signing would be effective. All right. So who may not learn ASL? Nobody wants to answer that one. Oh, interesting. Okay, we have some answers here. No one. Okay. It's interesting someone mentioned blind people. So we actually use tactile sign language. There is tactile ASL that people who are blind can utilize. Yeah. And then maybe people who have cerebral palsy or mobility, but the really anyone can. So disabilities, people who have motor skill or motor function disabilities. They actually have researched that there are plenty of deaf people with cerebral palsy, plenty of CODAs who are born to deaf adults who learn sign language, and they use a modified sign language. And so really, again, it benefits everyone, and no one is excluded, right? You said maybe people with no hands. That's a good question. Yeah, potentially, but I believe technically, for the most part, I think most people would be able to learn ASL. Are most deaf people skilled lip readers? Depends. Yes, research has shown that 20 to 30% of deaf people are very skilled lip readers. And so, again, you're only receiving, even skilled lip readers are only receiving 20 to 30% of the information when they're only reading lips. So it is more of a kind of activity, but reading lips is not. And personally, I grew up where essentially I was forced to try to read lips, and people asking me constantly, "Can you read my lips?" Now, can I understand when someone says, "Can you read my lips?" to me? But I will tell you, yes, I understood that they're saying, "Can I read your lips?" But I answer the question, no, because as soon as you say yes, then they just begin speaking. And then now I'm in a situation where, did anyone understand what I just said there? So I think the idea is, in general, lip reading is not to be relied upon and become overwhelming very quickly. So we say that lip reading is a talent that some people may or may not have, but it's not necessarily a skill that can be relied upon to receive information. And these are just some examples of things that are very, very difficult to understand with just lip reading. Does anyone know if I said bat, Matt, or Pat just now? Just with lip reading and watching my mouth. Right. It's impossible to tell the difference. So did I say bat, Matt or Pat first? Can anyone tell? You need context, right? Okay. Good one. Now, what about that second line? Did I say I love you? Island view? Olive juice? Can anyone tell just from looking? I'm going to say that yeah, I did say olive juice first. But in particular with things like this is where lip reading kind of lets us down. And it's, especially expecting deaf people to be able to do that. So someone guessed the island view, right? So these are things you can try them yourself in front of a mirror and just see if you can tell the difference of what you're saying, and just as an experiment. But this is where misunderstandings begin, right? And remember again that ASL and English are very different languages. So deaf people that have never heard English before, potentially people have some auditory function are considered hard of hearing. Maybe they have heard English spoken, but for never having heard spoken English and then also being expected to read lips without any context whatsoever, it of course leads to many misunderstandings and failures to communicate. All right. All right, we'll move on if everyone's ready. A question for you all. Do you know what percentage of deaf children are born to deaf parents? 90%. So you think 90% of deaf parents have deaf children? Oh my gosh, and there's a 1%. That's a very big difference. All right, someone's at 20. Okay. 90%. Wow. So it's actually the opposite. It's less than 10%. So deaf parents typically between 70 and 80% of their children are born hearing. Oh, there it is. Okay. Someone thought that we said deaf parents or deaf children to hearing parents. Okay. So yes, and you would be correct in that case. But yes, so deaf children born to deaf parents would be less than 10%. It's very small, which means 90% are, yes, 90% of deaf children are born to hearing parents. Often sign language is not used in the home. They don't actually learn sign language or aren't taught sign language until they get to school. We do often see children with language deprivation who are left without that access and without that ability to communicate. And it does affect them developmentally and mentally. They typically will develop their own communication style and use gestures just naturally. So it's important to really be flexible with individuals who maybe use gestures or different signs and not be very strict with this is the only way that ASL can be done. So what does it mean? What is the impact of being CODA? We say child of a deaf adult is a CODA, or having a deaf family member. You maybe all watched the movie CODA that recently came out and won an Oscar this past year, as an example. Someone said, yes, it can be very stressful for CODAs who are expected to interpret. Okay, and yes, but they also grow up with the opportunity to be bilingual. Absolutely. And the stressfulness of the children who are forced to interpret, it's often basically because of, yes, they don't actually often will not realize until later to really embrace sign language. Often we're not, you know, codas feel stressed because they feel alone. They feel like they're the only ones. They communicate in sign language, but that it would be really to my work with universal design, if sign language was used more often, some of those stressors maybe wouldn't occur for the codas at a young age. Can deaf people obtain driver's licenses? Yes, 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 of course. There are countries such as India that do not allow deaf people to drive. In Japan, deaf people are allowed to drive, but only if they utilize hearing aids. That is a part of the law. They also have laws where you can't use sign language in Japan while driving. So, you know, you can't assume that all countries are the same. However, in the US, of course, you know, the National Association of the Deaf did initially go to bat and make sure that deaf people were allowed to receive driver's licenses and drive. So. Can deaf people use a phone? Yes, TTY, wow. That is some old technology. We use more video phones now, yes, and texting, of course, so things have changed as far as what constitutes a phone and what phone usage is. And yes, depending on your level of auditory function, sure, you could maybe even speak on a phone. I myself, I use a video phone, I text. That's how I use phones. There are senior citizens who still use TTYs. I imagine the day is coming where those will definitely be obsolete completely. All right, so I've asked you a bunch of questions just to get an idea of your responses and see kind of where you are and what you know about the deaf community and deaf individuals and perhaps maybe what their needs might be. So I'm impressed. But to go back again and really go into what some of the obstacles that deaf people face. And this is from Harmer, 1999. But the impact on deaf and hard of hearing individuals in the United States and what they must cope with in their experience. So I'll just let you take a moment to read this quote. And unfortunately, it's still going on today. We see it come up in different situations, especially deaf people are faced with this in their receiving healthcare in the healthcare profession. So just to keep in mind that, you know, deaf people will go to the hospital. Everyone has to go to the hospital. It's a service that everyone at some point in their life has to use. And honestly, so often, most of the time when you're first born, you're born there in the hospital. So from the beginning of life, you experience healthcare needs and situations. And then throughout your life as well. Your kid grows up into a toddler and falls down and cuts their chin, and you end up in the hospital. And then, of course, toward the end of life, as you age and need more services, we utilize the hospitals and the healthcare systems always. And so to be able to have sign language interpreting and that access in the hospital can be really difficult and can be very isolating and separating. They use VRI, the video remote interpreting machines. And while those can you know, be really beneficial, the technology, it can also be problematic. And a lot of deaf people have faced obstacles and issues with that. So just to keep in mind that everyone is going to interface with the healthcare system and hospitals at some point, and there are obstacles in every situation that a deaf person encounters. So when I introduced the concept of the whole community. So you know, since Hurricane Katrina and the terrible devastation that happened there, communities were kind of left and into these disparate groups. And so one of the concepts that came from looking at the data and looking back at the response to that disaster was the whole community concept, which essentially means, you know, that all people could learn sign language, or at least some, you know, in order to partner with community agencies and organizations so that people aren't marginalized and aren't falling through the cracks, so to speak. So in 2011, of course, this is a little background on where this concept was first come up with. So community members, regardless of age, economics, accessibility requirements, must be accounted for when we're planning and implementing disaster strategies. And that makes sense, right? So of course, we don't leave out anyone. It's the whole community in and disaster. And of course, with technology at this time, you know, the field work in emergency preparedness, as I mentioned, the data is something that we really need to be focusing on. And that is there are nice aspects of that are upcoming at this time. So within that concept of the whole community, there are 3 principles. So understanding and meeting the actual needs of the whole community, engaging and empowering all parts of the community. So, and then also seeking out what strengthens, what works well with communities on a daily basis that could be applied. So how does the whole community concept apply to deaf people in particular? So I'll give you some things to think about. And you all will probably come up with some of your own. But when you look at this picture, which one is the deaf person in this picture? Can you tell? Who's hearing, who's deaf? Right. No. So are they deaf? Is that what you mean? Or can you tell? Right. And we can't tell, right? So what if I told you that they're all deaf? So this is actually a statue at Gallaudet University. And one of them is holding, you know, there's a design behind it that indicates that this is on Gallaudet University's campus. And so, yes, this was actually a National World Association for the Deaf students who came. But looking at that group of individuals in that picture with the Gallaudet statue, it's a person that's signing. But otherwise, would you know? How would you know? Right. And so, I mean, when you look at it, when you look at a person in general, it's impossible to tell who's deaf and who's hearing. And it's really not until maybe you see them signing or see people talking. You know, it's considered what we say, an invisible disability. I don't know that that's the greatest term for that, but essentially, yeah, until you see someone, you know, maybe using sign language, we kind of make an assumption in general that the people that we see are all hearing people, right? And this is from Carol Patton about the deaf community. I'll give you a moment to read that. And, things are changing a little more. We're not considering, the community itself doesn't necessarily, it's not made up of entirely deaf people. Hearing people are involved. So we're, considering changing that to more of a signed language community versus a deaf community. But, because there are people that for various reasons become involved in these communities based on sign language, not necessarily deafness. But the idea is that the deaf community is broad and vast and does include many people who you wouldn't necessarily know. This quote is unfortunately what is still happening. Harold Lane, who was a very prolific hearing researcher, but he did notice, basically he basically took it to the mainstream platform, talking about race, and on a national platform about race and the LSQ and the different priorities that are given to different individuals. And so, as priorities are given, those who don't use speech and spoken language end up being oppressed. And so you can see his comments and research here about the need for community participation. And now, seeing about what it's talking about, cultural sensitivity and some of the barriers that really we have the opportunity now to break them down and to make a difference. And so I appreciate each of you for joining tonight to really make that difference start and begin with you. Some of the limitations to the emergency services, kind of along the lines of assuming that all people are hearing and use speech. I went to a Deaf Educators Conference. They invited the Red Cross. There were also members of different federal organizations. And the concepts or what they were offering were kits, right? And I asked the question about the kits that were being distributed, and what happens in a disaster is the Red Cross has all of these descriptions, information, instructions that are online in English. Now, the ways that people were utilizing the kits, they had to then at least have a certain level or grade level of English proficiency. So in addition to that, when they're sending out emergency alerts, those are coming out in text form in English, again, requiring a certain literacy rate or literacy or English proficiency. And so why not have those in sign language? Why not have video messages? Why not have video tutorials and instructions about how to use these kits and use the emergency preparedness tools? And of course, it's difficult during emergencies. They're talking, if you need to have interpreters, there are certain places, for instance, like a surgical room where you wouldn't necessarily be able to include an interpreter based on the different parameters, required. But they're just different reasons and ways to have creativity around making sure that things are accessible. The hurricane that happened in New Jersey, Sandy, whenever they had the interpreter on screen to give out the emergency preparedness information from all of the people who were designated to give out that information, the screen actually cut the interpreter in half, which effectively left us without having any real access to the language. This happened, we saw again with other things have improved since COVID, but we see this happen over and over. The technology has really made things better for all of us, but we still often see that interpreters and that kind of language access is typically on the back burner. It's not considered, and it's there and it's better, but it's not considered a priority often. And then are there even enough resources and access for people to learn sign language? And that's another obstacle and barrier. And are there opportunities to refresh what you have learned? So after we have this presentation, will you ever see sign language in this context again? And so having that opportunity and that access is going to be vital and important. And of course, all of these limitations, all of these obstacles can be conquered by, creating more public awareness, by including signing deaf people in the emergency management planning, like Layla, the work that she's doing. And also by hiring signing deaf people on emergency management staff. So, and you'll see from from Layla's presentation, and she and I met a while back when I was actually studying myself. And so she is now working in this professional capacity in emergency preparedness, again, in Australia, which is not necessarily always benefiting the US. And in FEMA, I think that we have, I believe there's about 4 or 5 roughly signing deaf individuals on staff, but always room for more, always room for improvement there. And I think it's important to keep in mind that all people can learn ASL. It can be a tool that all people can use, right? And it will benefit society in general to just have more awareness and not dismiss the deaf community, because knowing sign language makes everyone more aware and have more access. It's, of course, vitally important for deaf people to have their culture recognized, and as soon as we are marginalizing groups and prioritizing one culture or one way above another, we lose sight of diversity. We lose sight of the respect for diversity as well. And so really to kind of disseminate sign language across the board in more public spaces just makes access to that even more crucial. There's also the Martha's Vineyard concept, which I'm doing some research on currently. Previously, Martha's Vineyard, everyone spoke and used sign language on the island. It was from, the 17 to 1900s, and then that kind of dissipated after a time. But over the generations, there were a lot of genetically deaf individuals who were born there, and everyone used signed and spoken language. And so instead of having to provide accommodation so that deaf people, could now fit into hearing society, it was a dual language society at all times. There was no accommodation needed because everybody could communicate and had accessible language. So I just have a link here, and we'll probably share this PowerPoint, but that might be some more information on the Martha's Vineyard sign language and that concept that you may be interested in at a later time. And, I said to you before that I, was in the Lutherville fire department previously. Is anyone here from that department? I haven't even asked, and maybe I used your picture without without your permission, but these are some of the students that we did the learning experience through Clemson University at the Lutherville Fire Department. And so this was some training and services that we provided. And now I hope that you've gotten kind of a general overview and idea of how we can work together, how we can collaborate in order to be more inclusive of deaf individuals. And Layla is now going to speak to some emergency related signs and also discuss a little bit more in depth and then have it opened up if you have any questions. So take it away, Layla. Thank you so much. Hello, everyone. And I'm sure everyone's excited to learn some basic sign language to use in your work. So before I start, I would like to just ask, how many of you have ever experienced working with deaf individuals in emergency situations? Has that come up for you? Okay. We're getting some yeses. And so when that situation occurred, what did you do? What were you thinking? Were you able to kind of gesture to how were you able to provide emergency services to them? Okay, a deaf EMT yourself and have been a deaf patient. Okay. That's great. And then we didn't really go into that, but like a direct communication line, yes, using sign language is amazing. Yeah, some people didn't know. Okay, the person who was able to write, presumably in English. Okay, and then learning a deaf EMT to learn CPR, wonderful. So, and again, we mentioned it already, but having that direct communication, the benefit of that, having people on your staff who are deaf and use sign language, I mean, there's nothing better than direct communication. Relying on an interpreter is, of course, best practice always. But from the time that emergency situation happens, first responders, and then being able, to actually then receive medical care is typically that time is when you were at the you're receiving the medical care is when the interpreter comes onto the scene. So all of that time prior to that would be incredible to have that direct communication. Okay, yeah, small portable dry erase boards. Yeah, great solutions. And there are different ways to communicate, many different ways. Some deaf people, do prefer to use sign language, are maybe not as comfortable writing or using English. And some people, maybe depending on the emergency and what is going on physically with them, aren't able to write, right? And so the benefit of knowing and having sign language at your disposal is clear. And before I show you a few signs, I do also want to let you know, that there are professionals who work in emergency departments, and we have in Australia some deaf individuals who work in our fire departments. And I know that that can create some friction, and I think hearing people often are shocked and also not sure how that's going to work. But we are really actively putting it out there that, let's not let our fears and what we our assumptions dictate how we proceed in this. So I think it's really pretty easy to pick up some simple signs. And again, we do this in Australia. But you starting at a basic level, knowing some signs can make you a little more comfortable when you encounter and are faced with deaf individuals on the job. And if you're interested just on this basic little lesson, we think that, please seek out more. There's definitely ways to learn to communicate that will only benefit you. There's no harm done in learning, right? So these are just some basic signs that we have, in terminology we use in the disaster field. I see a comment coming in. Yeah, absolutely. Absolutely. Discrimination. So there's fear and there's discrimination, right? So I think, and technically as a staff member of the fire and rescue department here, I also work, I work in the department, but I work as a fire. I wanted to work as a firefighter particularly and was told no. And it's because there's this very auditory based thinking that firefighters are only would need to be able to hear. And again, I think I could in the fire department, being a volunteer, we have a lot of fires in the bush, in the brush. We have brush fires, grass fires here in Australia that are very prominent. And so I have been allowed to work in that field, but was not able to, be approved to work for house fires because they were requiring spoken language and being able to hear. So that is something that we are fighting against actively, equal opportunity for firefighters. But I agree, discrimination happens, and I have experienced it myself. So some basic disaster signs and terminology. When you look at this list, of course, these are very basic terms. And whenever you are approaching a deaf person in a disaster situation, we want to use the word help. Now that's a directional sign. So if you're asking a person, can I help you? You would move it towards them, right? Because you are offering to help them. Also, if you're indicating, would you like some water? We would sign water and point to them, like as in, would you like it? The sign for need and hide. Shelter or house, we can sign in a couple different ways. And it again depends on context, really. If we're saying shelter in place because of a disaster or fire, then we would actually want someone to, escape and go to another shelter versus be in the house. This is the sign for nurse. Maybe some of you work as in the nursing field. You might say that, hi, my name is so-and-so, and I am a nurse. You could also indicate that if you are a doctor, so that the individual knows who is speaking to them. Fire person or firefighter, because of the hat, right? This is a sign for police. Does anyone know why? It's because of the badge that police officers typically wear here on their chest. There are signs for tornado. This is one of them. Hurricane. So tornado and hurricane are, of course, different. With tornado, we use one finger. With hurricane, we use two. The thumbs connect, and it moves forward in a path. Out. You might be telling someone to go out or in, correct? So here you've got your one hand that goes out or back in. And safe. And you can ask someone, are you safe?
What's the sign for safe?
Safe. So they cross in the middle and go out.
I have the PDF of the medical signs that you sent me. Do you want me to share that in the chat? Is that helpful?
Sure. Yes.
I feel like
Yeah, absolutely. Yeah. And actually that's in my next slide. So
I feel like
sure.
the signs go by very fast.
Oh, yes. And apologies. Yes. I can go through them again a little slower. It's hard when I don't see you all. Can you all see me? I'll make sure I'll go through them a little slower again. Here we go. And I'll follow the list. So help. And of course you're offering help at that point. If you're asking the person if they want help, you would move it towards them. Water. It's a W on the chin. Water. Need is a crooked X finger like this, and you put it out in front of you and kind of shake it. Hide. This is their one hand goes under the other in a hiding motion. Shelter or house. And for the word shelter, that can mean different things. We kind of typically indicate going in under something. Because if you're just looking for shelter, any safe place, not necessarily a roof, you would go in under something. And then a house, of course, you kind of indicate the outline of a house with your hands.
Mm.
Nurse is actually with the N, letter N on your wrist, and doctor is with the all four fingers. So the N there for nurse, and then doctor with all four fingers on the wrist. We often say firefighter or fire person. It's with the B hand shape on the forehead, indicating, kind of the helmets and that shape at the top. Police, indicating a badge on the chest. Tornado. So you've got your index fingers and they spin around each other and move forward. And hurricane, the thumbs go together and the two fingers kind of float out there and you move it forward as well, like it's moving in a path. The sign for out is to kind of remove your one hand from out of the other. And the sign for in, or to go in, is to put your hand into the other. And then the sign for safe. So the S's cross and then they move out toward the sides. It's almost like they lock and then you're free again. Safe.
Beautiful.
Great. Good. I'm glad everyone's following. Does anyone have questions or anything about this list? Do I need to repeat? Okay. Next, we'll look at some signs that you can be used in sentences. The signs go with facial expressions. So when you say what, and again, depending on context, when we say what, we kind of put it. I'm sorry, I was using Australia. So I'm sorry, yes. It's opposite actually in ASL. Yeah. You would shake your two hands, what? In Australian Sign Language, actually that means where. And so sometimes I have to get it right, but yes, what in ASL. So you would look at someone and kind of shake your hands, what? And I don't have where. Yeah, so what? Apologies again. It really is kind of silly that those two signs in particular are exactly the same sign, but exactly opposite words, where and what. And so in Australia, this sign means where, and this sign means what. It's very rare for the signs to be literally that contradictory, but they're literally in reverse. And so it always breaks my brain a little, but okay. And I am focusing on ASL. I don't want to confuse anyone. But so what? And then the next one is what is wrong. And so that's the Y hand shape on the chin. And so you would kind of lean towards someone and you can combine those two things. What is wrong? What is wrong? Or you can kind of indicate and lean forward. What's wrong? This is yes. It's like a head nodding. And this is no. So the two fingers and the thumb go together. And then of course you saw my facial expression. And you wouldn't be like, yes, no, in the opposite way, make sure your face and your head motions are matching the sign you're using. Me, you point to yourself. You point to it, and pointing is okay. Point to the person. Sick is with two hands. You kind of lean back a little and you put one hand on your forehead and one on your chest. You can ask the question, are you sick? By leaning in and saying sick you, or say, I am sick. You can also ask if someone's okay, and that is just spelled okay. You kind of lean forward and say, okay. I mean, and again, that's kind of a finger spelled thing, but it was okay as kind of a universal. way of asking if someone's okay. Breathe. You indicate kind of lungs and chest moving in and out. Breathe. And so you can ask, are you breathing okay? Right? So big open hands, asking if you're breathing. If you're saying, come with me, you basically indicate come. To go, you can send in several different ways. Go, just kind of indicating with the palms sliding across each other that we're leaving. Hospital, actually the word for hospital in sign language changes depending on what region you are in. I know often we use hospital, we kind of make a cross with an H on the shoulder. And that's basically from back, long ago when the Red Cross or the medics had the cross on their shoulders. There are some areas, especially in the Northeast, that use hospital across the forehead. So they say it's like an H on the forehead. So depending on what area you're in, you might see different signs for hospital. So there are regional variations of signs. But in general, if you use the H in the form of a cross on the shoulder, most people won't know that you mean hospital. An oxygen breathing mask, and of course, breathing and breath, you can use that same sign for that. And so the mask goes over the nose and mouth, so the oxygen mask. And so for any kind of emergency situation, an oxygen mask is likely to be applied. So that's a sign that's helpful. The sign for fire, the signs kind of go forward and up and the fingers wiggle. So you wiggle your fingers in a circular motion. Now earthquake. So you sign earth and move like a quake. So the earth is a fist and you're kind of indicating that this is your earth and it's shaking like a quake. You all don't live in the West Coast. That is something that we experience a good bit on our side of the earth, but still a good sign to know. Blizzard. Now there is a sign for snow. So kind of regular snow is just the fingers indicating softly falling. But when it's a blizzard, it becomes much more intense, right? So you're kind of showing with your mouth and your face and your hands how intense the snow is. And so you want to use context for how much it's emphasized. So do you notice that I kind of grit my teeth and I'm really showing how much snow, and then I even showed like how much depth of snow there is to indicate blizzard. And the last word on this list is vomit. I'm sure some of you, have seen it happen. We're not going to get too grossed out by vomit, but you use your 5 hands and it's literally just coming out of your mouth, vomit. It's not the best visual of all time, but sign language is conceptual. So there you are. Does anyone have questions about this list?
Should I share that attachment?
Sure.
All right, give me 1 second. Maybe we can take a moment for folks to see if they can access it. Why can't...
Okay. And I also have the PowerPoint in this, the PDF in this PowerPoint as well. And so if we're sharing the PowerPoint, people will have access to that later as well.
Oh, got it. Thank you.
Yeah, and of course, finger spelling the alphabet. This is a slide you can print and keep this for yourselves. So the finger spelled ASL alphabet. And then the next slide also. So a comment on this PDF. There's a few resources in this PowerPoint that you can, of course, print out for yourself to keep with you. And, you know, it's kind of a just in case there's a deaf person on the scene. You're not sure that you remember all of the signs that you just learned today. And this can be just a helpful kind of refresher or a remembering moment to be able to say, oh yes, and I could use these few things with this person. In Australia, we have something very similar to this for when people go to the hospital and medical professionals will come up and they say, oh, we're waiting on an interpreter to arrive. So during that time that we're waiting for an interpreter to be on site, what can we do? We have these kind of basic medical terminology sheets that really, you know, instead of, you know, having to read English, we have these sheets. Now, I will say when I went to the hospital, the nurse just handed me one of these and I said, okay, I actually already know sign language. This is actually for you, for you to be able to learn how to communicate with me. Right, right. It was really kind of like, okay, but then the nurse said, oh, I have to learn, you know, sign language. And I thought, yes, right. Yes, this is information for you to know. You don't know sign language, so this might be helpful for you to communicate with me. And it was kind of a aha moment, a teachable moment, let's say, because again, people don't realize, right, when we prioritize spoken and hearing language, we don't necessarily realize what we don't know or don't have access to. So yes, a little funny story, but also really to emphasize the point that we all can learn and this could be beneficial.
Layla, can you go back a slide? Because I know a lot of the participants are probably taking a picture of this on their phone.
Oh, sure. Okay. You mean the ABCs?
Yeah.
Yeah, let me ask Jody to go back one. There we go. Do we need to review the ABCs? Is
Sure.
anyone interested in that?
Sure.
Okay, we can go through that. So this is A, B, C, it looks like a C, D, the index finger up, E, all the fingers are bent in, F, like the OK symbol, G, you can see it either up or kind of on its side is G, H, it's your thumb is in and your two fingers are pointed out, but your palm is facing your body. I, palm facing out with the pinky finger is the only one extended. And now you keep the I hand shape and just draw a J in the air. That's J. Now with the K, you want to make the 3 hand shape and move the thumb in to the middle of those two fingers. That's a K. It's one of the more difficult shapes to make. L, index and thumb. Now with M, you move your thumb all the way under on top of the pinky, and then you have 3 fingers on top of the M. It's also a difficult hand shape. You put the thumb all the way under, and it looks like an M, right? With the 2 humps, 3 fingers over, M. Now, N is very similar with the thumb that goes under the 2 fingers. So M and then N. O, making the shape of the letter O. Now, do you remember K, where we did the 3 hand shape and we put the thumb in the middle? Now we turn that upside down for P. Okay, and you remember G on its side? Now we turn that upside down for Q. R isn't easy to remember. Remember, right? Remember starts with R. R. S, So the 5 hand goes into a fist and the thumb is on the outside of the fingers. S. T is the thumb under just the first finger. U. So just the index and the middle finger, but pushed together. And then V, you separate them. U, V. W, you add the ring finger in there. So you've got the V and then you add one more for W. X is that crooked finger. So the index finger just crooks down. X. Y is the thumb and the pinky out. The 3 fingers in the middle go down. That's Y. And last but not least, Z. With your index finger, you draw a Z in the air. Does anyone have questions about the ABCs? Okay, if we were face to face, we would have a competition to see who could do their ABCs. But unfortunately, you all are off the hook because they don't get to see you. Okay, so that's the alphabet. We do have these basic medical signs charts here. The first one is indicating pain. And so you kind of move the index fingers towards each other and you kind of, indicate with your face too. Are you experiencing pain? The next one is address. So that's where you live. And so you indicate with your A hands going up your chest, your address and where you live. The sign for advise is a flat hand. And then on top of that, you kind of are giving advice. You are distributing advice. So, if the doctor is giving advice to you on these different things, that would be what they would do. It might be important to know if someone has allergies. So you go from the nose, you touch the nose. So this is a sign for opposite or anti. And so you touch the nose and it means you have allergy. Something in your body is anti. So that would be an allergy reaction. You may be scheduling or requiring appointments. So you have a fist, and then on top of it, you make your other fist. It kind of circles around and lands on it. That's an appointment. It sort of starts with the A hand shape as well. Aspirin, or taking a pill, it looks like you're kind of popping one in your mouth, right? We talked previously about assist and help. So again, that's the A help, and and it's directional. So you can say, can I help you? You can move it towards someone if you're offering assistance.
Is thumb up, thumb down important in that? It looks like thumb down.
Yeah, it does. Really either.
Mm.
Jody, do you have a thought on that? It's really, he said, let me get back where I can see. On the assist or help, in ASL. Yeah, it really, it either one.
Okay.
Yeah, either way. And I've seen both. So I think, yeah, either one, if you're indicating that you're offering it, I think either way is fine. Baby, you kind of indicate rocking a baby in your arms. You can hold the baby in different ways. If you're asking someone about where on their body that something might be happening, so you could say back by just touching kind of your back, indicating where an injury might be. Bathroom, so indicating a place. Bathroom is with a T, and we shake it. The T stands for toilet, and so shaking the T is the kind of the sign for bathroom. Bed. I'm sure some of you are ready for bed at this point, but it kind of, I know it's your nighttime. I'm here in the morning, but you're indicating lying down, bed. Yeah, I'm sure it is. It's 8:20 at night there. Yeah, I'm sure you are ready. This is better. So it goes from the chin and up into the A hand shape. Better. Blood. So you've got the 5 hand in front of you, and then the blood is the other 5 hand, kind of goes down, indicating kind of like leaking or dripping blood. Breathe is one that we went over previously. So you indicate the lungs extending and retracting lungs. If we're wanting to indicate that we need to calm down, it's kind of everything's up here and we bring it down. Calm down. If we want to say that you can do something, you would use the S hands and you have them up and they come down as well. If you can't, we're saying you can't do that. It's one, and you would again use it with the facial expression and the head shake. Can't is the index fingers kind of tapping each other in a downward motion. If we need to change something, you have the X shape hands here, and you indicate that they are changing or turning, which is a change in something. So they kind of go together and turn around. It's a difficult sign, but if we need to change something or change position, we can say change. Indicating a part of the body, the chest. You can just touch it or show it. If we want to say chill or cold, and really, you know, if we're related to having a cold necessarily, but chills are, you know, your whole body shakes. So you kind of indicate, and you can show with your face and your whole body that it's tensed up and shaking. Any questions about any of those? Clothes. That's a pretty easy one. We're just indicating that you're wearing clothes, right? So it's the kind of 5 hand shape, and you just indicate that you're talking about clothing. If you're saying come on, we indicated come earlier, where we can kind of beckon, or we can just say come on with me, kind of a thing. A cough. It's kind of a fist on the chest, and repeat the motion over and over to indicate a cough is happening. Or do you have one? You might want to ask, are you deaf? And you would use the index finger. It goes from the ear to the mouth to indicate deafness. Deaf. Dizzy or dizziness. You know, we have that swirling motion. You can use 1 or 2 hands. It honestly kind of depends on the level of severity. You know, some people might sign just like, yeah, I'm feeling some dizziness, but if they're really, you know, the whole world is turned upside down, they might indicate with 2 hands dizziness. Doctor is one we've seen before. If you don't know something, you kind of to put your hand on the forehead. So you would say, I do know, and you would tap your forehead. If I don't know, you would move the hand away from the head saying, I don't know. Drink. So you just kind of mimic having a cup in your hand and drinking, drink. Drive or car, but yeah, indicating using a steering wheel essentially. Ear infection. You would point to the ear, and this is kind of the sign for infection. So it's just like a shaken eye in front of you, the letter I. Hope you don't have ear infections. Hope you never get one. They're terrible. And this is a sentence that you could use. What is your name? So we use what, and we learned before, your, and then name. It's the letter H, two of them, and you tap them on top of each other for name. And then if you want to indicate, can we write? And you might have some paper with you, and there's a pencil that you're using. So if you encounter a deaf person and you have questions for them, you might say, can we write? And if you're indicating an X-ray, the sign for it is actually to spell X-ray, X-R-A-Y. Any questions about those? All right, let's go to the next.
And for those, while we're waiting, I did put the PDF that Layla shared in the chat.
Thank you. Great, Sean. So for those of you who happen to work, this can happen on campus situations, but also, in others, but these are some signs if you work in emergency situations on campus. So parking. Remember we used that 3 hand shape before, the 3 fingers to indicate a car. And so if its car is parked, it's kind of sitting on the palm there. The sign for ticket. So you've got the closed hand here, palm facing you, and then you ticket it with the 2 fingers going either side. Think of the old time, you had to punch tickets literally, and that's kind of where that sign comes from. You may need to indicate that something is illegal. So that's with the palm facing sideways and the letter L, and it bounces off. And you see with the face too, illegal. Someone's going too fast. So it's the open hands and it jerks back into a fist. Too fast. Slow down. So the one hand kind of draws up the arm of the other. You've seen us use this sign a good bit, but emergency is with ease, and you kind of shake them up to indicate emergency. Hurt is actually the same sign as pain. So are you hurt? Are you in pain? The 2 index fingers kind of circle and point to each other. Classroom. So class is with the C's, it makes a group, and then room makes a box because essentially rooms are mostly boxes. So that's a double sign. So classroom. So with the C's, they make a group, and then the box for the room, classroom. Seizure. So it's kind of indicating these are two legs basically, and they're bent, and then they are kind of seizing or having a seizure on the floor. So that's the seizure sign. University. So in the palm facing up, you use the letter U. It kind of goes up in a swirl. That's a university. Faculty is usually signed with the F hand shape, and you cross it from your opposite shoulder to the one nearest your, or yeah, the adjacent shoulder. Faculty. Student. So you have the palm up, and you draw out of the palm to your head and then indicate a person. So student, this here indicates a person when you're saying like a body. And so a student is someone who learns. So a learner or a student, and then a teacher is someone who teaches. So teaching is out from the head and then into the sign for body or person. Where, yeah, different from Australian Sign Language, and I promise I'm not messing it up, but where is with the one finger and you kind of shake it. Dorm is a sign where with a D, and you do it from the chin to the temple. It's kind of like the sign for bed, but with dorm, that's kind of where you sleep, right? Or with a D, excuse me. And are you all right or all right? With the palm up and the other one kind of sails up from it. And so you can indicate that you are all right, or you can ask if someone's all right. And the sign for alarm. So palm facing up, and then the index finger beating against it to making an alarm, like a bell. Questions?
I think we've got them all.
Okay, and it looks like there's a question. Yes, good question. So if the person here in the chat is saying, if I want to ask if someone can help me, yes, you would pull it towards you, right? That's the directionality of it. So if you're asking if you do you need help, you would point it, bring it towards someone saying, can I help you? But then if you want to ask for help yourself, can you help me? Yes, you would indicate bringing it towards you. Good question. So the PDF there is a good review. Please, feel free to print and use that. Find a deaf person to practice with would be even better. But yeah, keep that on you, or keep that in your, your toolbox or bag, or in your vehicle, just to have ready for you, because it's not, whatever I just told you now is not going to remain in your memory forever. So that's something that can help you to refresh. Yes. Okay. So what to do, since we've learned some signs, what to do in an emergency when interacting with a deaf victim. So you indicate, or a person is not responding to you when you're speaking to them. I know some of you are going to automatically speak to someone, and when you realize that they're not responding, it might be that you can kind of take a moment and see, is this person deaf? An appropriate way to touch or get someone's attention is on the shoulder, a tap. And if they do respond to that, that you'll know that they are deaf. You want to make sure that you're in a visible area. I know lights are going to be important for communication. There are some situations where that's not possible. Things happen at nighttime. A flashlight is a really great tool and better than nothing to make things visually accessible. With deaf patients or deaf victims of an emergency, establishing eye contact is really essential. And deaf people don't just watch hands, they watch eyes, and keeping that eye contact is important. If you are, tapping someone, trying to indicate things and you're not getting a response, of course, some of the time, it's our natural, it's sometimes hearing people's natural instinct to say, can you read lips? We really appreciate if you just even try to sign, try to communicate in gesture, and communicate that way rather than asking for lip reading. If you're still getting no response from the deaf individual or the deaf victim, you can try writing. Deaf people, again, have various levels of literacy. There are also people who have moved here from other countries, immigrants who don't know English. And so gesturing and communicating in that way is perfectly acceptable, especially for individuals who don't use reading and writing. So writing can work, but it really depends on people, because most people who are deaf and use sign language do use that primarily. And so that's going to be the best bang for your buck, is to try and use sign language or gesture. And if a deaf person in an emergency situation, it's very difficult for them to know where to go. If you're kind of pointing around and it might not still really indicate where they need to be. So guiding or leading them, showing them where to go, so to where they are safe or where they are going, into a car, or down to a safe spot or a shelter, that showing them is really important. And then finally, making sure that someone who knows sign language is there and can help, right? So calling an interpreter, a professional interpreter, is going to be key. Now, again, if you want to make sure that you're getting really the most appropriate response, you want to provide equal and fair access to communication from deaf victims. Basic sign language that is going to be great and really useful, but won't give you the full picture and the full access to what that person needs to express to you. All right, and I'm going to let Jody take this portion. Thank you. If you have any questions, I'll respond at the end. And there was a question in the chat, actually, asking about dialects. Did you see that, Layla? Oh, I'm sorry, I missed that. And actually, I can respond, I think, if you want me to. So this is Jody. So what Layla had just mentioned, an example of like immigrants coming over and not necessarily using English, but having that equal access and making sure that you have someone, a professional who can sign, is really important. Again, time is of the essence in a lot of these situations. So the best communication that you can do is to just be flexible as possible. And really to not enter into these spaces with the attitude of I don't know, or I'm a fear or something, where it's really important to really just try your best. You asked the question about altered mental status. There are some incredible mental health programs in South Carolina. Actually, the Department of Mental Health here has really great programs and resources for deaf services and mental health and altered mental status, but it is, it might be worth checking into a little bit deeper on things like that. but that is a tough thing to be able to tell if you're not fluent. And apologies, I know that time is running short. And I know we need to kind of wrap things up here, but to talk about what as a whole community, how can the whole community be recognized, and how can we have that reciprocity between victims and emergency professionals in a really meaningful and useful way? So we talked about the PDF that was just shared in the chat, and then also shared a bunch of those signs. So thank you, Sean, for sharing that. Please do use things like that. Resources with just some basic signs are just really helpful. It's not everything you need to know, but can give you a kind of a minimal starting point to use and study and practice with someone. Practice with each other. That was a great idea Layla had. Practice with a deaf person, but anyone else who maybe is interested and getting some of that minimal sign language skills down and things that you can commit to memory. Taking an ASL course, if it's available and possible, is really, really would be really beneficial. It would be nice if they offered that everywhere, but I know, it's hard to set expectations in emergency situations that everyone is going to have that kind of access, right? So we do recommend that all healthcare and emergency first responders should have, 2 or 3 professionals who can sign, are aware of deaf people and available. Does it have to be, a full-on professional sign language interpreter when, all we really need to ask is, can I get you some water, or, are you in pain, right? So, or where is the pain? Can you just show me, now, if you're wanting to get really to the, in a healthcare situation where we're really needing to go into a health history and things like that, of course, professional sign language interpreter is necessary, but it could be that other professionals would be sufficient given the emergency situation and time. So hiring deaf professionals in emergency management and emergency room staff, and knowing when to use ASL interpreters, like I just mentioned. Sometimes that might be what's required, and sometimes not. And so knowing the difference there, and knowing how to request an interpreter. So when things get intense and it's really serious and we need one, how do you do one? How do you do a request? How do you contact and find interpreters? So, and again, I think the real idea here is just to always keep learning and always be open to this possibility. So there are some brochures that might be available to, this is an older company, but that is a place that you can order some. I don't really remember how much the cost is, but it's pretty minimal. So that might be helpful, even though some of the signs might be outdated at this point, because that's what happens with brochures. But we have some references, more things for you to look at. I hope that we've given you a starting point to kind of visualize and think about how you would interact with a deaf person on an emergency scene. How can you be refreshers? The door is open for us to, add and provide those at some point for you, should you decide as a department that that's what you would like. And then I guess, yeah, if you have any questions, I'm open. Layla said as well, very open to questions, and thank you all for having us.
That was excellent, you guys. So much to
Thank
think
you.
about. So much to think about. We're so far behind. It must be so frustrating interacting with health side.
I mean, Jody said it's not something that we dwell on.
How often do signs change? You alluded to at the last that the brochure may be out of date. How often do signs change with context and culture?
Um, good question. Layla, Jody? Yeah, so I guess it kind of depends on the community itself, right? So the deaf community does make alterations and changes to sign language. I wouldn't say that it's like on an annual basis. I mean, I don't think English changes that quickly either. I mean, the dictionary accepts new words all the time, I guess, but it just kind of depends on the community and what what they bring in. And Layla said, there are some signs that have, survived over the generations, but maybe be modified or changed and altered, right? And I think it is very similar to any spoken language that depending over time, how the language kind of changes to fit, yes, the current needs and concepts. Sign language does the same. Oh, and kids, Jody said, the kids these days will come up with all kinds of stuff, right? So we're always kind of just chasing them. Yeah, and developing new signs even, not even just modifying or altering, but developing new things. I've got a deaf niece, Layla said, that tells me things that I'm like, what is that? And she's like, you don't know? And I thought, no, I guess I'm old. Like, I guess that's where we are now. So
Same.
yeah.
There was a couple comments. Do signs change more in younger people? Spoken language changes with younger. Yeah, it sounds like very much so.
Right. Yes, and email the brochure. Yes, we can send that. Absolutely. So I can send the link for that to everyone who attended this training.
That's awesome. Again, I want to be respectful of your time and thank you so much for what you do. And thank you for sharing all that with the first responder community.
Absolutely. Thank you for having us. We appreciate it. Thank you.
Have a good night.
Yeah. Thanks for having us again. Have a good night.